Hi everyone, you're welcome to this channel again. Today I want to address one of the two major questions I got in my DM following our video on antenatal care. The question is, why did I challenge the frequency of scanning during pregnancy? I have no objection to anyone who decides to take snapshot 7 times in a day or 7 times in a week. If you are not taking your scan during the critical period that it helps in the diagnosis and the onward management of the pregnancy, you are just taking picture. It had no value or contribution in the management of the pregnancy. Yes, it makes you feel good when you snap picture and you look at yourself, you're looking beautiful. It also makes you feel good when you snap, when you do the ultrasound scan. My baby is kicking, my baby is fine. Now, let's talk about the relevance of first trimester ultrasound scan. As I alluded in that video, there are two major critical times you need to scan unfailingly. First trimester, 20 weeks of your gestation, then if need be, 36 weeks. The first 3 months of pregnancy is an incredibly important time. This is when your baby organs and systems are developing rapidly. During your first trimester scan, usually this is done between the 6th and the 13th week. We are able to verify that pregnancy is inside the uterus and not outside. The term called ectopic pregnancy. If you ask your doctor, he will tell you how dangerous it can be if not detected on time or if not attended to promptly. That's number one. Number two, it helps to check the baby's heartbeat. Hearing that little heartbeat is a magical moment for many parents. In addition to that, it's a magical moment for some doctors, especially when you've been on medication or treatment for fertility issues, because it helps to establish viability of the baby. After which you can now say, okay, let me go and register for antenatal care. Most importantly, it helps to determine the due date. In other words, it helps you to date your pregnancy. When we measure the embryo to estimate how far along you are and when your baby is likely to arrive, we are trying to establish so many things that can impact the course of the pregnancy. It is different from just deciding to go and take a scan at will. Dating a pregnancy has caused a lot of confusion among those who do not have this understanding. That's when you hear clients saying, I'm confused. 3 months ago, they gave me 21st of October. 3 weeks ago, I did a scan, they gave me 30th of November. Now they are telling me again, 15th of October. Then they gave me, who is giving you the date? Then they say, scan. Scan does not give date. Scan is bound to give you various dates, especially when you're doing it at the later stage of the pregnancy. There are different purposes for which we are doing them at different times. Outside the first trimester, once the date is established, date doesn't change. Your birth date does not change. So whatever you're seeing afterwards is not your new date. You are taking scan at the other day for other reasons. Please, let's take note of this. Do you know the scan can also help you identify multiple pregnancies, which mean a prompt diagnosis of a potential hazardous pregnancy. It also helps you to assess any potential risk and then spot certain birth defect. When I say birth defect early on, like when there is congenital issue, the heart is this, the kidney is this, the liver is this is this. This is not forming well. This is forming well. This early scan can also not only be for just checking on the baby, but also about your health as the mother of the yet unborn baby. So if you are pregnant or you are planning to be, don't skip that first trimester scan. Every pregnancy is meant to be planned. Let's reduce, it's a mistake. Then you are discovering at 7 months or 6 months. It's a vital step in your journey to a healthy pregnancy to have scanned in the first trimester, established so many facts. Feel free to ask us questions in the comment section. Share your experience. Also, feel free to tell us how you felt when you saw all the scans of your baby in utero. the various scans you've done by yourself without the prescription of the doctor. Thank you for listening. I remain Dr. Adesoya Adewale, who always reminds you to go healthy and save a lot of money. Thank you for listening. Bye.